We're delighted, apology for the slight delay, and we're really delighted today for episode 31. Can you believe it? It's been 31 episodes that we're going to be bringing you the chief scientist from WHO, Dr. Soumya Swaminathan. Very delighted that she can join us. And today's moderator is somebody who we're very familiar with, has done several programs with us on this COVID update, Professor Keiji Fukuda, who is the director and clinical professor at the University of Hong Kong School of Public Health. And he will be moderating today's session. And we're going to talk about Delta variant. And please send your question on Slido for the experts. And it is a topic that we're really, COVID, we're going to continue to do the series until there is no COVID. So with that, I'm going to hand it on over to Professor Fukuda to get today's program started. Thank you.
Great, thanks, Alice. I'm exceptionally happy and honored to join Alice and colleagues from the Asia Society in having a discussion with Dr. Soumya Swaminathan. I know from experience how busy people at WHO are during emergencies like this, so I'm really grateful for Soumya for taking the time to talk with us. As Alice mentioned, we're going to largely focus on COVID and Delta related issues, but because of Soumya's position in WHO, I did want to take advantage and start off with a few broader questions just to get a sense of how she is looking at things. And I think that one of the first things I want to ask her about is that, in concept, a lot of people have understood for decades that a severe pandemic was possible. And as you know, we've had a lot of notable events before COVID. And these have included things such as the emergence of HIV/AIDS, avian influenza, SARS, Ebola, MERS, and so on. And there have been a large number of books published about this theme. Nonetheless, I think it's pretty clear that the reality of COVID has still profoundly caught everybody by surprise and shaken up most people. And this includes, for example, the capacity of the virus itself to become more transmissible, as we are seeing with the Delta variant, the ability of COVID as an event to disrupt the functioning of virtually all countries and all lives in the world for such a long time. The duration of it has been eye-opening. And moreover, I think that it's clear that COVID has been a rather harsh and very unflattering floodlight on the state of global geopolitics and how we are treating each other in terms of sharing of resources like vaccines. So Soumya, the first thing I simply wanted to ask you was that when you reflect about the global experience and what you've been seeing about it, what are the aspects that stand out most for you about COVID and why?
Thank you so much, Professor Fukuda, and delighted to be with you. Just came off a member state briefing. As you know, we've been doing these every week for the past many months. So you asked me what stands out and what's new, and I'd like to mention a couple of things. I'll start with communication, and particularly science communication. I do think we've seen a complete paradigm shift in the way in which science is being communicated to the general public because of the huge interest, of course, in anything to do with the control of the pandemic, and particularly the interest in vaccines and in drugs and in the tools to control the pandemic. So I think it's been mostly positive, though there have been a few downsides. Why is it positive? Because people, the general lay public, is seeing on the front pages of newspapers and television channels what science can deliver and how science is done. The downside, of course, is that sometimes they get confused because scientists, obviously the science is evolving when you're dealing with a new pathogen. And so things change, new findings come up, which then necessitate a change in policy. And some people interpret this as scientists don't know what they're doing. They keep changing their mind. So I think it's also up to us to explain how science actually builds its incremental and also that you have to change your views when you see the evidence before you, even if you believe something else before. There's also, because I think this first pandemic in the social media age, there's this what we call infodemic, a huge amount of information out there that people have access to through the internet, through social media, through all the different channels. Some of it is credible and good, proper information. A lot of it is not. It's misinformation or willful disinformation, like the various conspiracy theories and the anti-vax theories and so on. So we've had to not only learn how to communicate much better, much more frequently, openly, transparently, in a way that people understand, but we've also had to deal with the misinformation. And there's a group of people at WHO now who are actually now developing a field called infodemiology, which is a multidisciplinary exercise with social and behavioral scientists and epidemiologists and communicators and teachers who come together to see how can you fight misinformation. So I think that's one thing that stood out for me. The second big thing that's stood out, of course, is that science ultimately is what we need to rely on to deliver the solutions, whether it's diagnostics, it's all of this genome sequencing that we're going to talk about a little more, and it's a development of these new platforms, the mRNA platform, the viral vector platforms. These have been developed through decades of investment. And now these investments are paying off. This is the first mRNA vaccine that's been proven to be effective. But obviously now it opens a door to many other pathogens. Similarly, if you have monoclonal antibodies, we've also seen a proliferation of clinical trials. I think, again, it's good that countries are interested in doing clinical trials. We get a huge number of requests from countries and groups that want to be part of the Solidarity Trial platform. But also, again, the downside is of having too many small clinical trials is they do not answer the question, and they can actually lead to some confusion, because small trials which are not powered to answer the question can often lead to a wrong conclusion. And therefore, when we're reading the literature, people have to be able to distinguish between a well-done, well-designed study and a poorly conducted study that has lots of flaws and biases. The third big takeaway for me has been the disappointment with the global solidarity around the access to these tools. I mentioned that science delivered the tools. Scientists around the world, whether they work in the public or private sector, really came together and collaborated in an unprecedented way to develop these new tools. But countries and governments could not do the same to agree on an equitable and fair distribution and access to these tools. So this is why today we see this inequity, particularly, it's very striking with vaccines, because we're all looking at vaccines, but it's the same with diagnostics. If you look at the rate at which diagnostics are available and used by people in high income versus low income countries, there's something like 120-fold difference. And with new therapeutics like monoclonal antibodies, again, there's very little access in low and low middle income countries. So that's been, for me, a disappointment and a lesson that we need to learn to set it right for this pandemic and also prepare for the next one. And stop there. These are my big three takeaways.
So thank you, Dr. Swaminathan. These certainly resonate with my experience that I've seen in the past, and I think particularly many of the challenges with communicating. But I want to pick up on the last point, which I think for any of us working in global public health has been, a bit of a disappointment, the point that you made. And I think it's arguable that in our lifetime, the greatest advancement for dealing with health security, global health security challenges like COVID that we're seeing now, has not been technological, as great as things like mRNA vaccine platforms are, but has really been diplomatic. And that was the decision of WHO member states back in 2005 to adopt the international health regulations. I thought that was a game changer when I was at WHO. And I really have always liked the IHRs, the international health regulations, because they, in many ways, really cover the essentials. As you know, they invoke the responsibility of countries to assess small events and risks while they're more manageable, and to share the information before the event becomes a large emergency. It covers the responsibility of countries to strengthen their core capacities with the assistance of WHO and the international community so that they can better handle events like COVID. And also it covers the responsibility of WHO to exercise global mechanisms and processes to make decisions and more coordinated actions. And so the international health regulations really encapsulate that. And yet, as you point out, when COVID occurred, in many ways, the world's governments really backed off from a multilateral response, and things like global solidarity were not very much in evidence. And so I want to ask you two questions in this regard. One of them is, why do you think multilateralism, global solidarity largely failed in COVID? Is it the geopolitics of the moment, or do you think that there's something longer term going on? And the second question related to that I wanted to ask you is that, as you know, there's now very serious discussion and planning going on for the WHO meeting in November to discuss further discuss the potential for a pandemic treaty, so-called pandemic treaty, or at least to be a little bit more diplomatically nuanced, a potential agreement or instrument. Could be any of those things. But, to be blunt, why should people believe that a new pandemic agreement can succeed when the international health regulations were significantly ignored and global solidarity really was not very much practiced? So I'd love to get your sort of perspective and take on that difficult question.
Indeed, and I'm not sure I have the answers, obviously, Keiji, because you asked very good, very important question. And I often ask myself the same question. But I think a couple of things may be different this time around. As you say, the international health regulations were adopted in 2005. They were to provide framework for how countries detect and respond and notify WHO. And they're also supposed to be a guide to countries, obviously, to set up their own surveillance systems and strengthen their public health systems. What we saw actually is that even in high-income countries, the public health systems, collapsed or failed and were not up to the mark. So some of the benchmarks that have been used to, in a way, grade countries on their preparedness for health emergencies actually were found not to be the right parameters. And so we need to relook, and this is why we now have what's called the universal periodic review of health emergency preparedness, which will be launched in a voluntary way. There are several countries that have volunteered to be the first ones to do that. This is a peer review kind of a mechanism. Member states will work together to review each other's, because one thing which has become clear is that preparedness is not only important and essential for a country for their own health security, but it's important for all other countries in the world, because something can arise anywhere in the world, and before you know it, it becomes a pandemic unless early action is taken. And so I think that realization that it is in the self-interest of every country to make sure that every other country's capacity to prevent, to detect, and to respond to these kind of biological threats, which are going to arise in the future as well. This is not going to be the last pandemic. It's not the first. And it's a question of how can we better be prepared to respond. So I think that realization is there. You mentioned all the different committees. We had the IHR review committee. We had the independent, very high-level panel on pandemic preparedness and response. And we've also had, of course, several of the existing committees that oversee the WHO's emergency program. They've all more or less recommended that member states must come together to learn the lessons, to review what happened, and to lay down some parameters and rules of the road, at least for the future. And these, of course, would be across a number of different areas, starting with the preparedness and response. Data sharing is going to be critical. Data sharing, knowledge sharing, information sharing, biological sample sharing. If Chinese scientists had not uploaded the whole genome sequences of the SARS-CoV-2 virus on January 11th to a public database, GISAID, we would not have had diagnostics within a few days, and we certainly would not have had vaccines in the timelines that we saw. So it's really important that all countries share data. We've had some difficulties in biological samples moving across borders. There are other global rules like the Nagoya Protocol under the Convention of Biological Diversity, and signatories to the Nagoya Protocol, have national regulations. But we need to make sure that when there is a health emergency, when there's a health security threat, that there is a way in which you can go past these national regulations and have these emergency provisions, which Nagoya actually provides for, to be able to ship samples across borders in a very rapid and timely manner. This is why WHO is now setting up the BioHub, which will serve as a mechanism for countries that want to share specimens. And this will start as a voluntary mechanism, but hopefully can be something that a future pandemic treaty actually lays out guidelines for. And another area would be around the R&D and equitable access. How countries invest taxpayer money, public funds in the development of new tools, and how these could be considered as global public goods. Because again, when you look at the pandemic today, you have pockets of the world where people are unvaccinated, the infection is continuing to increase and transmit, and the virus continues to mutate. New variants will arise and could actually overturn all the progress that's been made even in highly vaccinated countries. So again, it's a global situation and a problem. It needs a global solution. We have the science to develop the tools, but how that science will be used, how those solutions will be shared, is what needs to be laid out. So there are several areas where we need to build on the international health regulations, perhaps clarify some of those, but ultimately, I think it's political will and decision-making at the highest levels of government that will determine whether or not any rules, global rules, systems are followed or not. But I think this time around, because of the huge impact it's had on not only health, with over 4 million people now having died, known to have died of COVID, the real number is probably much, much higher. And the huge impact on global economy, on countries' economies, and on everything else, on education, on livelihoods. I hope that this is the last time that, this happens, and that we have a more effective way of responding as a global community the next time around.
Yeah, no, I very much hope what you are saying comes to fruition. I think that, hopefully this level of impact really does drive the change that we're all looking for. So Soumya, let me shift it and pick up on one of the things which you mentioned. I think that I want to talk a little bit about the Delta variant in the current period that we're in. So, clearly countries worldwide are in very different places in terms of COVID, in part how they're handling infections in terms of their strategic approach, whether to go for zero infections or whether to try to accommodate some level of infection and normalize social activities. All countries are trying to vaccinate their populations, but here, as you've mentioned, we're really seeing a lot of the disparities. We have some countries talking about third doses, while others really have yet to receive any meaningful supplies to provide first doses. And this is a global equity issue which WHO has appropriately been very vocal about, for which I'm very glad. So in this mix, in this complicated global mix, both epidemiologically and response-wise, we now have the emergence and spread of the so-called Delta variant. And, it's really complicated the picture in a lot of ways. I'm not exactly sure if it is a game changer, but it has been called that. So, can I simply ask you, from the WHO perspective, what do you see as the main challenges raised by Delta virus for countries, but also for WHO as an organization? And the flip side of that question is that it's clear we're going to see the future emergence of other variants, and some of them may be benign, some of them may be worse than Delta, but we're going to see more variants in the future. So is there anything that we can learn right now from how we're trying to address Delta that is going to help us address future variants better, so they don't set us backwards? Love to get your thoughts on those.
So as you know, we, as soon as we knew that what the virus was, that it was an RNA virus, and of course we had some knowledge about previous coronaviruses, but didn't know the details of this one. I think everyone expected that the virus would mutate, would change, would evolve. And so it was really good. Again, I must say that having platforms like GISAID that made it possible for scientists around the world to share genomic sequence data as the outbreaks progressed in different countries, made it much easier. Again, probably a global first, that you're able to track in real time the development of new strains and be able to find out much more about them. So I do think in this pandemic, we've seen lots of new innovations on the scientific side. Again, because the hardware and the software and bioinformatics capacities today are available in many more countries than there were in the past. But I should add that there are many, many parts of the world where you have big areas without that capacity. And so for large part of Africa and also Latin America, we really need to build that and strengthen that. And that's one of the things going forward we're working on with partners. But we started tracking mutations, and quite early on in March of last year, in fact, it was from Asia, from Singapore, that we saw the emergence of the D614G mutation, which at that time conferred some advantages in terms of transmission over the Wuhan strain. And after that, things seemed to be quite stable for a period of time. And everyone was thanking their stars that this virus didn't seem to be mutating as rapidly as we thought it might. But then towards the end of 2020, we started seeing the emergence of the B117, which is, the alpha variant in the UK, described in the UK. Very soon after that, the beta variant, the gamma, were described from South Africa and Brazil. And then, of course, Delta, that was first described in India, but has now become the most transmissible variant that we've ever seen. Now, we don't know, and we cannot predict when there will be another major variant of concern, when and where and how it will arise. What we do know is that the virus has plenty of opportunities now because it's quite rampant across the world. New cases, something like 600 to 650,000 new infections, again, documented new infections every day. So probably in excess of that. And so this is a ticking time bomb in a way, because at any point there could be a variant that is either even more transmissible, has a different clinical profile in terms of disease severity, and also is able to overcome the current vaccine-induced immunity or natural infection-induced immunity. And we're seeing that Delta is able to transmit quite efficiently. And the current batch of vaccines that we have, we are delighted with the performance of the vaccines we have. The mRNA vaccines, when they were first, results came out, were 94, 95% efficacious. I don't think we dreamt that we would have such effective vaccines, considering that for influenza, we have vaccines that are in the range of 40 to 60% effective. So they're safe, they're effective, but it's clear that with the Delta variant, their efficacy against infection isn't as high. And again, it's not that we expected vaccines to completely prevent infection, but the early data from the previous variants, the Alpha variant and so on, which was encouraging. It was about 70 to 80% efficacy against infection, and of course, very high efficacy against severe disease and death. But with the Delta variant, this seems to have been reduced. And so people are getting infected even after being doubly vaccinated. And they seem to have quite high viral loads in their respiratory tract. So they're able to transmit also efficiently to others. So luckily for us, most of the data that's now coming out of places that started vaccination quite early in December and January is showing that the protection against severe disease is still very high. Is still in the range of 85, 90% and above. But what it's telling us is that variants, the Delta variant is transmitting very efficiently, and therefore vaccines alone are not adequate. So even in countries that have high rates of vaccination, we still need the universal masking, especially when we're in indoor settings. We still need the other public health measures, the ventilation, attention to ventilation, and respiratory hygiene, as well as continued testing and surveillance on parts of governments, as well as the quarantining and isolation and other things that we had been doing all of last year. Until we are able to get the transmission levels down significantly, we will need to continue to do those in addition to using vaccines, while at the same time tracking the further evolution of the virus so that we can have early warning of any more worrying variants that might be cropping up.
So, Soumya, I have a ton of questions which I could ask you, but I want to turn over to questions now coming in from the audience in the remaining time. So one of the questions to you is related to Delta variant, and the question is, with Delta variant, should we be expecting the rate of herd immunity to increase to over 70%? So herd immunity has been discussed a lot in relation to this.
Herd immunity is a very complex concept. And it's not, so there's no one cutoff level. Yes, with more transmissible viruses, herd immunity, the concept of herd immunity is that you have to get a much larger proportion of the population immune before everyone is protected. So with the measles virus, you want, which has an R naught of about 18, you want over 95% of the susceptible population to be vaccinated in order to achieve that herd immunity. So with the original Wuhan strain, we thought getting to 65 to 70% would be good. With Delta, that number is getting closer to 85%. But again, I think with this virus, it's clear that there are many other factors which actually influence that number that we call herd immunity. It also depends on the amount of social mixing, what the other public health measures are. So it's clear that we shouldn't be looking for a magic number. We need to vaccinate as much of the adult population as possible, as rapidly as possible. WHO has put out some goals for the world, 10% by the end of September, 10% of the population of every country in the world, 40% of the population of the world by the end of the year, and 70% by the middle of next year. That should start getting us into the range of some sort of population immunity that will at least reduce the force of infection and will hopefully lead us to a situation where we can manage this infection, just like we manage other infections, and resume normal activities.
Soumya, another question is that, let me just read it to you directly. The US has plans to use booster shots. I know that WHO is against booster shots, but I read somewhere that booster shots may be necessary for elderly or in homes for the elderly. So that was the question.
So let me clarify, it's not the WHO is against booster shots. The WHO's guidance, as you know very well, is based on data and evidence. And we actually have an expert advisory group, the SAGE, that makes recommendations on vaccines. And they are reviewing the data practically on a day-to-day basis and updating our guidance whenever there's new information. So the SAGE has looked at the evidence, we've looked at the evidence. And as I just mentioned, as of now, it appears that the vaccines are still protecting people against severe disease and death. And therefore, our main goal right now is to end all these preventable deaths. We still have something like 10,000 deaths a day, known deaths a day, reported deaths worldwide. And this should not be happening because the vaccines can prevent mortality. We need to get those vaccines out to people who are vulnerable, regardless of which country they live in, so that we can bring the death rates down as rapidly as possible. Then we start vaccinating the rest of the adult population. And this should, by then, we will also have data. It is possible that there's some waning of immunity in some groups, particularly the elderly. It is also possible that different vaccines have slightly different duration and breadth of protection. And the third variable is a variance that might need higher levels of antibodies. So at this point of time, a goal here is not to eradicate or eliminate this virus. And so rather than boost those who already have protective immunity, let's use those limited supplies, because we do have limited supplies of vaccines at this point in time. Next year, we may be in a different situation, but right now, we have limited supplies. We want to take those to those countries which still need to vaccinate. They've only done 1 or 2% of their population. And then do the boosters for those groups when we have the data to tell us. If we start a booster program today in some countries, it's going to be very difficult to walk that back. The studies will never get done. And secondly, we are then continuing to leave people to die in those places which need those vaccines. So these are the reasons why. So there are scientific reasons for us to say, let's hold off on boosters till we have more data, but also there's moral and ethical argument as to why this is. And that's why the Director General called for a temporary moratorium on boosters till the end of September, so that we can use those supplies to cover, to get to that 10% level of coverage everywhere.
Soumya, here's another question. I think a difficult question, but again, I'll read it. There has been a lot of mistrust against the government and governments and scientific institutions like the WHO. What do you think can be done to mitigate this problem?
Maybe we should get suggestions from people, because it's true that, and I mentioned it at the beginning, the pandemic, fighting a pandemic in the social media age can be good and bad. It's good because you can use all these channels. The WHO has done that to disseminate the messages that we want to reach people, different languages, different platforms. But it also ends up being too much information overload for people, and some of it is outright wrong information, misinformation. And people need to be able to distinguish between these, and that's sometimes difficult. And bad news always spreads faster than good news. It is true that countries where the level of trust in institutions, in the government, in public health experts has been high, have generally done much better than, and where people listen to what the government is saying because they have that trust and they know that what they're being told is backed by data, there's transparency of data, there's a dialogue with people to and fro, not just a top-down messaging, and there's genuine engagement of communities and people in all of these very difficult responses that we're asking people to do. Restrictions that are being placed on people, there has to be that engagement. So it is not something that can be corrected overnight, but trust has to be built, trust has to be maintained. This is true of the WHO as well. As you know, we've been very, very open in communications. We've had media briefings, we've had member state briefings, we've had all sorts of our experts have engaged in all sorts of platforms. We've answered questions to the best of our ability. And hopefully that builds trust.
I'm going to, there's a number of questions having to do with specific drugs and so on, but I think I'd like to focus a little bit more on some of the broader questions. One of them is that now many schools and parents are considering vaccinating their children, while other parents remain fearful of the potential side effects. How would you respond?
So that's a very good question. And I would say that, when we talk about vaccines, it's always a benefit risk assessment because vaccines are given to healthy people to prevent disease. They're not like drugs to treat. So you need a very high level of confidence and safety in a product before you use it as a vaccine. And WHO has a very stringent way of assessment before we put any vaccine on our emergency use listing or pre-qualify a vaccine for that matter. The issue of vaccinating children, there are a couple of things here. The first one is, of course, that the studies need to be done because clinical trials are usually done in adults. And then once they're proven to be safe and effective, most companies or institutions will do the trials in children, going down to lower and lower ages. They look at efficacy, at safety, at the dosing, because as you get into young children, you might need to use lower doses. And you also need to follow up these children to make sure there are not unexpected severe adverse events or immunological events. And so those studies take time. And it has to be done for every individual vaccine before it can be recommended. So as of now, we have a couple of vaccines where the data is available, where the recommendations for children's use have been made. But then beyond that, I think one needs to look also at the fact that most children who've been infected have done extremely well. They have either asymptomatic or very mild illness. And there's a tiny minority of children, less than 1%, that need hospitalization, and an even smaller percentage that end up with very severe illness and death. And while, obviously we don't want any child to get severely ill with this infection, if you compare it to the adults, the risk to children of this infection, thankfully, is much, much less. And we need to compare that with the risks to children of being away from school, not only on their educational attainment, but on their mental health, their physical health, their cognitive health, their social mixing. Children who've been out of schools for 1.5 years now, there have been many studies done which conclusively show that the impact on children is going to be far-reaching. So it's a whole generation, really, of children and adolescents and young people who are going to be impacted by these prolonged absences from school and college. And so this is why it's not an easy question It's not a yes or a no question, but what WHO, UNICEF, and the others have been saying is education needs to be prioritized by governments, by countries. That before you open restaurants and bars, you should open schools. And there are ways to do this safely. Now that there are vaccines available for adults, a good approach is to vaccinate all adults who work in schools, teachers, but also the support staff, and practice the other public health measures. Have good ventilation. All children above 5 can wear masks, should be asked to wear masks to school. Try to maintain the distancing, the respiratory and hand hygiene, etc. Have some testing protocols in place. And so with these kind of measures, particularly if community transmission is at a low level, it's quite safe to open schools. And in fact, the benefits will far outweigh the risks of there will be infections. If there are infections in the community, children are getting infected. And again, many studies have shown that most children who got infected got it in the families and the communities, not in schools. So while there could be some clusters and outbreaks that happen, those can be generally managed because now we can protect the adults who are the ones who are likely to get sick. So this is why we've consistently said schools education must be prioritized. Eventually, we may have vaccines for children. But again, I don't think that this is a decision that will be made very lightly. I think every country will think about in their own epidemiological situation, whether they want to go ahead and vaccinate children or not.
So, Soumya, I know that you have another meeting following this one immediately, and I know that Alice will close the meeting. I think maybe we have time for one more question. So this is again, I think another complicated, rather sensitive question, but I will go ahead and ask it. Can you comment on some people's criticism of Hong Kong's philosophy of fighting COVID? Hong Kong seeks to achieve 0 cases. Is that even possible?
Could you repeat that, please, Keiji?
Sure. The question is, can you comment on some people's criticism of Hong Kong's philosophy of fighting COVID? They, meaning the Hong Kong, seeks to achieve 0 cases. Is that even possible?
So we've seen this, that different countries have set different kinds of goals, and some countries have been successful in limiting transmission locally by having putting in place very stringent measures, really having very good surveillance, tracking imported cases, shutting down outbreaks and clusters. And I must say that we've seen this happening a lot in Southeast and East Asia, perhaps because of the previous experience of SARS, that both governments and citizens were quite tuned in and perhaps more responsive and knew what to do and so on. So Hong Kong's not the only state. We have other countries and territories that have taken that path and have been quite successful. Now, what's going to happen in the future is something that we will have to see, because I think most scientists today agree that at some stage we will enter a phase of endemicity. We move from pandemic to endemic. The infection will continue to be with us. It's not going to go away, but it's not going to cause this kind of devastation. That there will be people who get infected, who get sick, but the majority of people will have been either vaccinated or will have some natural immunity through previous infection, and therefore will be able to fight infection. So when we get to that stage and there's opening up of travel and trade across borders, I don't know what will happen in the countries that are currently managing to keep cases very low or aiming for 0. I can't predict what will happen, but hopefully by then we'll be in a situation where it will be a mild respiratory illness for the majority of people. and it will not matter then that much.
So Soumya, again, I am so delighted to talk with you and so grateful for the time that you've given to us. I know it's short. So Alice, let me, without further ado, turn it over to you for closing words. But Soumya, thank you very much.
Thank you both, Dr. Swaminathan and Professor Fukuda. Thank you both for taking time from your busy schedule to be with us for our COVID update. I think this is really interesting times, and I think we do need to rely on facts and science to help us guide every day. I think things are changing all the time, but I think basing facts just help us navigate through life, I think, in rather than rumors. I think that those are the things that I live by. But I want to thank you both, and I want to thank our audience for being with us. And there are future programs coming up at Asia Society. We'll continue this series. And if you enjoy the program, and we always seek your feedback and your support. And please join as Asia Society Hong Kong member. And we look forward to seeing you at future programs. And again, thank you both for your thoughtful comments. And I hopefully to have you both back in the near future and kind of enlighten us, I think, as this situation develops. And hopefully, I think the light at the end of the tunnel, I've said that before, light at the end of the tunnel, but I think it is there with, being able to get the vaccine so fast. And again, I think both of you probably agree, it's probably unprecedented. Many of us have gotten our double vaccination. And so hopefully vaccination rate will continue to increase. And whether we reach herd immunity or not, at least I think the community will need to work together to solve this global pandemic. So thank you both, and thank you to the audience. Good day.
Bye-bye.
Thank you. Thank you very much, and good day.